So what I suggest is you might want to make some comments to the committee, and then we might ask you some questions. But over to you. Thanks for coming.
Hello, my name is Matty Angel. A lot of you may know me either through the internet or bumped into me in person. And to those I don't know, thank you for giving me this chance to talk. What I'm asking for here is not just for me, but it's for the entire New Zealand, not just now, but also in the future. This petition has come about because people are afraid. They're afraid to say anything bad about their care because they'll lose their independence. Workers are afraid to say anything in case they lose their jobs. We're in a really dire situation. There's been multiple deaths from people either not providing adequate care or negligence from the companies for not providing right training. It's a really hard topic for me because I have had a few friends that have passed away from this. Some of them I knew directly and some of them I knew their family. The coroner is still doing active investigations into some of those deaths as far as I'm aware. And it's just getting to the point now where people are afraid there's going to be more people that die, and my friends don't want to die. I don't want to die. But if staff don't show up on time, some agencies have cut all their regional staff and only have a call center. You've got to wait 40 minutes to get through. If a care worker gives the wrong medication, they're not medically trained to deal with that situation, which it's so stressful for the staff that they leave. On top of that, you've got multiple agencies competing for staff, leading to some complaining they don't have enough hours and others saying there's too many, we can't cope. Burnout is very high and so is staff turnover. With the agency that I'm with, I have gone through maybe 8 coordinators in the last few years. They can't cope. They're a call center, they're based in Auckland, they don't know any of the clients. If someone has a direct issue, no one's going to go and talk to them directly. And it's just at a point where people, they don't know what to do when no one shows up. They can't get hold of anyone. I had a friend who's a paraplegic who ended up having to call the ambulance after 2 days of no one coming, and they were covered in bed sores. We're at a point now where the for-profit model needs to be looked at and the agencies need to be looked at, and we need to find out if their cost-cutting measures are what is in the best interest of the taxpayers who pay for all of this. On top of all of that, we need to remove the current level of fear that there is in the community, especially the disabled community. If they complain, an agency can just remove themselves. In 2014, I did have some issues. The agency dropped me on Easter weekend. I lived alone for a week with no support. My friend in Nelson had to drive down and give me a shower because I had no one else. And I've got other friends in that situation where there is no natural family supports. The system's falling apart, and we're going through all these health reforms, and I'm quite sad that this was not something that was looked into. New Zealanders deserve better, especially for what they're paying for, and this is a public health service. So it shouldn't just be left to all these corporations with no proper oversight. At least there appears to be no proper oversight. As far as I'm aware, no one's done an audit into any of these care agencies in recent times. And what are New Zealanders paying for? That's what I have to say. Thank you.
Thanks, Matty. No, and thank you for sharing your experience in particular. Not, you know, there's options to join via Zoom, but making the journey here to Parliament is in particular something special. So thank you for the extra effort there. Just see if there are any questions from any colleagues, including those online. The team may have to tell me if anyone online has put their hand up. Elizabeth Kitty.
Kia ora, thank you for being here today. We've had professionals come in from who work with people in the community, and they've also echoed staffing shortages, not being able to get people here. Do you think it's some of the solutions that you want us to look at? What do you think are the most important things to start with?
Right now, I think the most important thing to start with is removing the fear that people have of speaking up about what the issues are. People don't want to lose their independence, and people don't want to lose their jobs. I have care workers that put in 3 months in advance that they're going to have a week off, and it still hasn't been done until the last minute. And that kind of stuff is just, it's not appropriate, because then you've got these people going on holiday and you're leaving their clients. And I mean, yes, it's a professional relationship, but they do actually care and love the people that they're looking after. I've had some of mine for 7 years now who have stayed on my team. I was in hospital in 2020 and I was near death and dying. One of my care workers used up all her annual leave to stay on my staff for me to come back. And I think that the agencies themselves are not realizing that there is that relationship, and that when they do take a break for a week, they worry if it's not sorted out on time. I've seen them cry, being terrified that no one's going to go to the people that they have looking after, that they know quite well. And then you've got the problem of these people they bring in have got no training, no support, and they don't know who they're looking after. And that's why one of the agencies has banned bathing for their clients, because there were multiple deaths and they were fined hundreds of thousands of dollars. I think it's over $1 million now in fines. So their solution was to remove the ability of bathing, which for some people with disabilities, that is one of their few joys in life. And why haven't they been provided the training and support and proper guidance to do that instead of just outright banning something? It's just so confusing, I think. We just don't understand why it's come to this point.
Thank you. No further questions? No? All right. Matty, once again, thank you. That concludes your submission to the Select Committee. Thank you to your support team who are with you as well. We are going to hear next from the Ministry for 10 minutes, so you're welcome to remain and hear what their submission is in response to your petition if you choose to. Once again, thanks for coming in.
Thank you, everyone.
Thank you. Okay. Right, Ministry. They're via Zoom. Okay. Can you see a screen from where you are? That's that one up there that we're going to be looking at. So,
Does she want to come back?
yeah, look, you're welcome to come back to the table if it's easy.
You can see better.
If you come back to the table, then you can.
Oh, look.
Yeah, that one's the easiest.
Thank you very much.
There you go. Right, kia ora, good afternoon to advisors from the Ministry, officials from the Ministry. We have 10 minutes with you this morning. If you could keep your comments top line, and then we'll move to questions from members. Thank you.
Tēnā koutou katoa, ko Mark Pau te Puingoa. I'm Mark Pau. I'm from Te Whatu Ora, Health New Zealand. I have some colleagues with me from Whaikaha, the Ministry of Disabled People. I'll be presenting the submission. First of all, just like to acknowledge Matty and her experience. I'd like to start by just talking about giving a bit of an oversight of the sector and some of the putting the issues in context. Home and community support services support people who are recovering from an accident, are receiving palliative care, require help for mental health or addictions, or who are older or disabled so that they can live at home. Home and community support services, or HCSS as we call it, are provided to over 110,000 people. There's about 75,000 older people who receive services funded by Te Whatu Ora districts, 25,000 by ATC and private payers, and about 10,000 by Kaha, the Ministry for Disabled People. Te Aka Whai Ora, the Māori Health Authority, also funds kaupapa Māori services. The total number of providers includes providers that are for-profit and those that are not for-profit. The Health and Disability Commissioner reports on complaints, and the reporting doesn't break out the difference between for-profit and not-for-profit providers. The complaints have doubled, unfortunately, from 41 in 2019 to 80 in 2021. The HDC also fund the National Advocacy Service, and they report a 50% increase in home and community support related complaints. Te Whatu Ora has established a task force that will work with employer organisations, relevant union partners, tertiary training institutions and professional regulators to accelerate the need for a better trained workforce in priority areas while national strategic workforce initiatives are being implemented. Home and community support services are a valued part of this work of the health workforce, are one of the priority areas. Te Whatu Ora acknowledges the challenges in the home and community support sector and has increased funding in 2022-23 to the sector by 42.28 million, an increase of more than 7.5%. Now, I'd just like to give a bit of context over the last few years in terms of COVID-19. New Zealand, like the rest of the world, is facing a shortage of health workers. This has been exacerbated by the pandemic, and there have been periods when it has been necessary for providers to prioritise some support services. This has been necessary to ensure that people's essential needs are met. The result of this is that people will be experiencing or could experience some disruption to the support that they would typically receive. People using home and community support services should have been alerted to this potential. Information was prepared by funders, ACC, the Ministry of Health at the time, and district health boards to share with providers so they could communicate with the people they serve. With the emergence of Omicron and the exacerbating pressure from the outbreaks of seasonal influenza, unfortunately, the HCSS sector has continued to have challenges and where they've had to prioritise essential cares to those with the greatest need and to manage the workforce shortages as staff that are unwell or having to isolate. The Ministry of Health, Kaha, Te Whatu Ora and Te Aka Whai Ora have clear expectations of providers that reductions in service is a last resort, and it should only be done safely and as a temporary measure. Kaha, Te Whatu Ora and Te Aka Whai Ora are engaging with people who use home and community support services to ensure that there is an understanding of the specific steps that are taken if workers are unavailable due to COVID-19 or other challenges in the sector. This is to ensure that service delivery issues are well understood and managed effectively. Funders of home and community support services have implemented a range of strategies to mitigate the impacts of COVID-19 on home and community support workers and the people that receive the services. These include...
Sorry to interrupt you there, Mark. I'm just conscious of time and there might be members that have questions. Can I ask you to make some concluding comments? I'm happy for you. You appear to be reading from something to submit that to the committee if that's helpful. But can we please just move to some questions now?
Sure, I'm comfortable with that. Thank you.
Thank you. I'll just check. Dr. Levasar, did you have a question?
I initially did, Chair, but Mark went over the COVID-19 stuff. Really, it was just to, hearing from Matty's submission and putting it on Twitter and getting all that feedback, whether this issue was widespread, but I see that obviously it's doubled in complaints, and it looks like, if you can confirm, Mark, or elaborate further, the strengthening of the complaints process. So first of all, going to the service provider and then HDC. But can you just elaborate on that? Why wasn't it, I guess, pre-COVID? Now it's risen and all sorts.
Thank you. There were some challenges prior to COVID, but COVID had quite a significant impact on the workforce. We understand up to 20% of the workforce who were older themselves had to stand down for periods, and that led to a number of workers actually considering their long-term future as a home and community support worker, which as part of the challenges that COVID has presented itself for this sector. In terms of the complaints processes, they have been strengthened. So one of the things that's happened recently is that the Aged Care Commissioner has been appointed, and that's a role that has got quite a significant leadership, which will look at the systemic challenges in the home and community support sector and be able to report independently to Parliament about those challenges. We've also been doing work, the funders, as I've mentioned them, in terms of auditing against the standard. So that work, the standard better known as the Disability Service Standard, or Ngā Pairewa, is something that we're working with the sector to ensure quality services are delivered.
Thank you, Mark. We're nearly at time actually. We've got a couple of other questions. So Matt Ducey, and then if Lamalnga or Elizabeth. Okay, Matt.
Hi, Mark. Matt Ducey here. Look, we haven't got a lot of time, so I think Matty articulated the situation very well, and I think her mentioning that word taxpayer, so I think it's a good lens to go through that. Obviously, taxpayer funds that go into a very important sector, we expect a high level of care. You yourself have said that you've had double the amount of complaints, but you've put more money in. So we've put more money in and got a poorer performance. But you're really struggling to tell the committee, in a nutshell, what the issues are and what you're doing about it.
So just to clarify, the 42.28 million, that's gone in from the 1st of July this year. So I wasn't referencing what's gone in the past. And in terms, in a nutshell, as I outlined, there is a challenge right across the health sector in terms of workforce pressures. And this, unfortunately, is one of the critical areas for us. It has been quite hard. As I said, we've lost up to 20% of the workforce.
Yeah, so look, we get there. I'm just trying to move it on. So I understand you've lost some workforce, the older workforce through COVID. The immigration settings are probably not helping. So are you just being told no when you advocate for your sector to open up those avenues?
We're working very hard with the sector and our colleagues in the Health Workforce Task Force to make sure that we have a good pipeline of workers.
What does that mean?
Last question, Matt, and then.
So we're developing initiatives to increase the supply chain, so the supply of support workers.
All right, that concludes your time with the Health Committee. The next steps for the committee are to think about what it wishes to do next. So thank you to the Ministry and other colleagues there for joining us. And again, thanks to Matty and your team.
Sorry, you have to hear
We will
something.
now move into